Hi, my name is Dr. John Huang with West Chase Wellness Chiropractic Center. We are here going to demonstrate a chiropractic adjustment in my office, how it's like, and at the same time, I will do some narratives describing exactly what we do in the office to help you improve your quality of life. Here we go. So I use this drop table technique. It's called Thompson technique, and we use it to help curvature of your neck. A lot of people have a neck that's kind of forward or straightness of the neck, and this thrust from back to forward does help you with the curvature. At the same time, we do give you neck exercise to go home with, and there's other stuff you can do to help you do the curvature correctly. When you have a strain of the curvature, you will have, like, for example, headache, migraines, allergies, sinus issue, and you have sore throat, stiff neck, cough, and hand and finger numb or tingling, or high blood pressure. All those stuff could be affected when you have a nerve that's impinged on the neck area. Also, if your neck is impinged, it will cause some shoulder discomfort at the same time, and it does prevent you from sleeping better at night. And when you do have pain in your shoulder or your neck, our goal here is get you out of discomfort quickly as possible, so you get a better quality of life the whole time you get life. We do help people here with nutrition. If you're looking for a way to have wellness lifestyle, we have most of the answers to help you improve your quality of life. Most of all the answers you need, and our goal is to continually improve your life, because a lot of times as you get older, you go, wow, I never had that before. And when you start getting a regular chiropractic adjustment, the mobility can improve, and range of motion does get better. If you're an athlete, this is a good way to improve and enhance your athletic performance. A lot of professional athletes do use chiropractic care for the adjustment. If you just, for example, on a league of softball or soccer or basketball, something like this will help you enhance your performance in the senior sports. I'm talking about, like, men's team. I'm a big hockey guy, so I play hockey. I ref hockey, and hockey players do benefit from the chiropractic adjustment. If your kids also play baseball, soccer, or basketball, and this type of treatment adjustment really enhance their performance. And if you want them to get a scholarship one day, start them young in chiropractic care. We help them perform better. And if you could get a scholarship, you save a lot of money. So start them early. Chiropractic care is very affordable, and we help people sleep better at night, better mobility, increase your range of motion, stop the wear and tear to your joint. It's wonderful. I call myself a spine hygienist, because who's taking care of your spine? We know that most people brush their teeth once to twice or 3 times a day and floss and get regular checkup, of course, see dentist. But who's taking care of your spine? The spine has cavity just like a teeth. Arthritis, for example. Why you have arthritis this here and here, only a certain portion of the spine? Either through trauma, car accidents, slip and fall, also sports-related trauma, or repetitive motion, do over and over and over again. Okay, and what happens there? So what happens is, when people sit in front of a computer all day long, you're constantly in a bad position. That's called repetitive motion, and that does cause wear and tear to your joint. And a lot of people don't realize that wear and tear cause microtrauma over 2, 3, 4 decades or more. Then you have a problem. They'll come to me, doc, all I did was to bend down to tie my shoes, and I have a low back pain. Well, because she done that over and over many times, and you have bad posture, sit in front of a computer, you slack in front of a computer, for example, and that's what happens to your back. But we're very good on get you out of discomfort. At the same time, I know that one that You want to have better mobility. You also want to have better, less wear and tear to your joints the whole time of your life. That's our goal here, just continue improving your quality of life the whole time. At the same time, you go, hey doc, I'd like to have some nutrition support because I want to have better quality of life with good mentality, vitality in my body, and nutrition, eating correctly, proper exercise, drinking proper amount of water. All those things enhances your life performance. Of course, don't drink, don't smoke. Social drinking is kind of okay also, but you have to move the body, create that the body to have better function for the future. And we want you to have that improved quality of life the whole time of your life. Okay, breathe in, hold your breath, hold your breath, hold your breath. Good. Breathe out. That was a good one. Good. That was a real nice one. Good. Good. On your side for me, Veronica. Good.
On which side?
Now face me this way. Good. Perfect. Good. Excellent. Good. Awesome. Perfect here. Breathe in. Breathe out. Good. That's a good one there. Other side. Row, other side. Nice and easy. Perfect. Perfect. Good. Excellent. Thank you. Just like that. Breathe in. Breathe out. Good. Good. On your back face up. So we call it anterior hug in a patient. That way, I'll do a hug and adjust the spine. Later on, we'll do a stand-up adjustment on her too. She would like that. Just help to stretch her spine. Get the pressure off the nerve. That was good. Good. That was excellent. She likes that release. Helps her get out of pain. And she's sleeping better. And when she sleeps, she has a hard time sleeping. Her pain is pretty bad on her shoulder. But through the adjustment, it's been improving her sleeping. When you sleep better, you handle stress better. If you own your own business, it's a good way to do, because when you have better quality sleep, you can think clearly. You don't get frustrated or angry because you're in pain. And your business tends to thrive when you have less discomfort and sleep better at night too. That's very nice. Ooh, that's very nice. Good. That was a nice one. Good. 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 Oh, that was a really nice one.
I felt it stuck here and you just released all the pressure.
Pressure on the back, that's correct. Yes. That's what we do here. So you have a better quality of life, less pain, better mobility, better vitality. Chiropractic adjustment, what we do is turn on the life force in the body so your body can process information better. Yes, it does. Okay. That's very good. All right. I typically also do some her issues is right side, the shoulder, the neck. I do some active release technique on her just to help her release the tension so she can have better range of motion on her shoulder, so she can sleep better at night. And there's 4 muscles that are part of the rotator cuff muscle. The first one is the anterior deltoid, the deltoid itself. There's supraspinatus, teres minor, and subscapularis. All those are part of the rotator cuff muscle. Now I like to work on the pecs, see if the pecs also move the shoulder. And I have shoulder pain myself, and And because I did too much push-up without warming up correctly, and I shoulder pain. And when I do some muscle stretching, muscle work on my pec, it really helped release the tension on my shoulder. So those people out there doing sit-up or push-up or bench press anywhere, make sure you warm up correctly, slowly, so you don't injure yourself. And if you do injure, the body compensate, and what will happen is it'll lead to some other problem, and you have other conditioning along with the shoulder discomfort. Chiropractic is very safe. A lot of people don't realize chiropractic care has been around 126 years already. 126 years, and we're licensed by the state of Texas. There's a 4-year training to get this, and you have to do in that. We do help a lot of people. Musculoskeletal issue.
I'm in pain.
Okay, we're gonna stop now.
Only because you're doing the massage,
Yes,
but
yeah. Yes, I'm working on the muscle scar tissue to help break up the adhesion to her spine. And next thing we do the Y strap on her. Heads up.
Okay.
Good. Beautiful long hair there. Thank you. And we're gonna do a distraction. Create that pressure off that nerve we have here. Yes, wonderful. And typically we like to do is kind of do a little warm up, stretching a little bit before we do a thrust. The thrust helps them, like I say, decompress. It's called a manual decompression technique with a Y strap. We are here to help people get well. If you're in the Houston area or somewhere else and you want to get this, come by our office in Houston. And we help people all over the country, travel everywhere to come see us. So come check us out. Wow, that was wonderful. That's wonderful. We help people really get well and stay well so they have better quality of life. And also certified in pregnancy adjustment. My wife was pregnant with 2 of my girls, and I adjust them all the time still. And I'm also specialized in kid adjustment. I adjust my kid all the time too. That's wonderful. That's wonderful.
Oh yes.
That was wonderful.
That felt great.
That felt great.
That's where I felt the release.
Release of the pain, right?
Yes.
Yes. Come on, sit up here for me.
Okay.
Get nice and easy. Now move here. Good. Let's do this one. That's really nice on the shoulder. This one here. Oh, very nice. Good. There's tightness on the right here, under my finger. The very first bone in the neck, if there's out of alignment, it could cause you discomfort. Very good. Very good. One more thing I want to do is we're going to do a stand-up adjustment I mentioned earlier. So step down for me, Veronica. We're going to do that right now. Okay. Good. Yeah, just stand right there. And lock your finger here like you did before. Good. Get my hand there. There we go. Breathe in and breathe out. That was a good one. Whew. All right. Now, tell the world what you think since you've been coming in here, Veronica. Go ahead.
Well, growing up, I was an athlete, and I did favor my right side a lot. To sleeping, to using my right hand for softball, and also boxing, and also as an adult, like moving past those years, I was sitting at a desk and using the computer a lot, leaning over to my right side, favoring my right side, and also while I was sleeping, I was also favoring my right side, unconsciously, not knowing that I was doing that. So during the pandemic, we were not being as active, and I did come during that time, and this was when I started seeing the doctor and visiting the wellness center, and he's helped me, correct my posture, and you know, and not creating that hunchback that we all dread throughout the years. And of course, like, you know, you don't, it's like throughout the years that you'll end up seeing those results. So that he definitely corrected that there, because I did start getting like a slight bump here. And
Yes.
then prior to that, for like 10 years, I had this knot between my neck and my shoulder, like behind my neck.
Yes.
I had this knot right here for
Yes.
10 years and it didn't go away. So I thought that going to get a massage was going to work. And it never went away. So the first two visits, or actually the first visit when I saw the doctor, the knot was gone, like
Wow.
after 10 years. And
Wow.
that's, and you know, this is where I'm experiencing the pain,
Yes.
because
Yes.
I'm like this, sleeping like this.
Yes.
And so, I mean, ever since I started coming here and just listening to his advice, and, you know, when I'm supposed to come back, and being consistent, and, you know, you do see the results and you feel great. And I haven't gone to get a massage at all. So because I feel so great after I get my adjustment. So,
Awesome.
you know, just something that you can consider. I think a massage is more for like relaxation, but the adjustment is actually, you know, it really does cure your pain, and it really does, you know, align the spine, and it's something that other people should be more aware of, because, you know, as we get older, you know, that's when we start becoming cautious of like the effects that we have, you know, for our health and things like that. And we don't want to wait that long. We want to start at a young age. I'm 35, so I definitely want to stay young and active as long as I
Yes.
can.
Yes.
So thank you, doctor.
Hey, thank you. So please like us, hit the subscribe button, and also share the video, and hit the notification button, so when a new video come out you get notified. Thank you.